Radial agenesis or hypoplasia is a rare congenital condition estimated to affect approximately 1 in every 20,000 newborns, and it is known to occur more frequently in males. It can present in an isolated form. In this case, we refer to it as isolated radial hemimelia. In other rarer cases, it may be associated with aneuploidies, most frequently 13, 18, and 21, and it can also be found in association with syndromic conditions, including Fanconi anemia, acrofacial dysostosis, red nager, retarded osseous dysplasia, Chappelle, certain types of mesomelic dwarfism, thrombocytopenia with absent radius, which differs from the other syndromes as it is the only one in which the thumb is present, and Holt-Oram syndrome. This disease is associated with various degrees of radial deficiency, often accompanied by defects of the carpal bones and specifically the thumb. These cause a radial deviation of the hand and a marked shortening of the forearm. There may also be some degree of underdevelopment or agenesis of the thumb with an associated malformation of the elbow joint, which as a consequence leads to a limitation of movement. The clinical presentation of the disease is known to be extremely variable, as it can range from a simple mild hypoplasia, where there is essentially only a shortening of the radius bone, to more severe cases where the radius is completely absent, a condition that is referred to as agenesis, and as a direct consequence, the associated functional deficits are also highly variable. We would now like to present a specific clinical case that was brought to our attention during the 13th week of gestation as part of the standard and comprehensive first trimester screening protocol. On this occasion, in this specific instance, a comprehensive and detailed study of the fetal anatomy was already performed, and as we can clearly see from the images currently scrolling by, the upper limb is being carefully examined, specifically focusing on the left upper limb. In fact, the presence of the humerus was observed, which appeared normal from a biometric standpoint as well, while now, as we look at the forearm, what we are observing in this view is the absence of one of the two long bones of the forearm, and because of this, it is much more likely that the specific bone that is absent is in fact the radius. In these images that we are currently looking at, what also becomes immediately apparent is we can observe a lack of flexion-extension movement at the elbow joint, as well as the presence of what appears to be a twisted hand. Now, it's important to remember that due to this very early stage, it is particularly complicated to make a definitive diagnosis. However, it is already possible for us to observe that, specifically in the hand, there is also a very high likelihood of a complete absence of the thumb. This particular detail is very important because among the syndromes in which there is agenesis or at the very least a hypoplasia of the radius, we are able to distinguish some of these syndromes based on the presence of the thumb. As a matter of fact, the thumb is present only in the TAR syndrome, while in the other syndromes it is absent, which is precisely the case we are observing here. We can also clearly see that the contralateral limb, that is to say the right one, is completely normal, and now let us proceed to observe the profile. Let us proceed to observe the profile because in these images we are evaluating the presence of the mandible, which is absent in Naegger syndrome, another syndrome in which the radius is absent. We assess the nuchal translucency, which in this case is normal since, as we mentioned, this pathology affecting the radius can also be associated with certain neoplasms, and for this reason it is also important to evaluate the presence of a normal profile and nose. Now let us proceed to examine the association in our specific case, which involves a condition known as agenesis of the radius. In the provided images, we are observing the 4-chamber view, which appears to be entirely normal. We can also confirm the normal emergence of the aorta as it arises from the left ventricle. However, in contrast, and as is clearly visible in these images, this is not the case for the pulmonary artery originating from the right ventricle. In fact, we do not see the expected connection, and instead we can again identify an image of the aorta. Additionally, there is a marked levocardia. As far as the study of the heart is concerned, it is very important to point out that we are still at a very early stage of our research, and so a complete reassessment of the heart at a more advanced stage is most definitely necessary. However, even from these images, both with and without Doppler, we can already see that while the presence of the aorta is very clear, it is more complicated to visualize the pulmonary artery, and therefore its emergence from the right ventricle. And right here we can see the aorta again. The study of the fetus, clearly in this case, again due to the early stage, must also be performed transvaginally, where in addition to reassessing the heart, thus with the four-chamber view, the right and left sections, the upper limb is also re-examined. We can also see that in this particular case, with the transvaginal approach, there is what appears to be a normal humerus, but only a single bone is present in the forearm, in addition to a twisted hand, which we had actually already detected via the abdominal approach. Clearly, the diagnosis cannot be made solely by ultrasound, so in these cases it is always advisable to recommend that the expectant mother undergo fetal karyotyping through amniocentesis. In addition, it is critically important to carry out genetic counseling due to the very wide range of syndromes and cases in which we may potentially encounter agenesis or hypoplasia of the radius. Among the diagnostic hypotheses to be considered, for the clinical case that has just been presented, and based on the clear association between the upper limb anomaly and the congenital heart defect, a highly probable diagnosis is the genetic condition known as Holt-Oram syndrome. In this case, the incidence is 1 in 100,000 births, so it is a rare disease, and the transmission is autosomal dominant. In our case, neither parent was affected, so we are talking about a de novo mutation. This condition is characterized precisely by an abnormality affecting the upper limb, generally affecting the forearm bones, so the radius more frequently and the ulna more rarely, or even more rarely, there may be hypoplasia of the humerus, and this is associated with a congenital heart disease, usually with defects of the septum, either atrial or ventricular, or a combination of both, and sometimes there may be a heart condition, most frequently aortic coarctation. In fact, there may also be an association with other heart diseases. Thank you. Therefore, it is of significant clinical importance to perform a comprehensive reassessment of the heart study at a much earlier stage. From an ultrasound perspective, the primary diagnostic indicator is the presence of hypoplasia of the radius, which refers to the underdevelopment of this particular bone. From there, the heart is then clearly observed and evaluated to see if there is any abnormality affecting the heart. Very often, a club hand is also associated, as in our case, and very often the thumb is absent. After that, it is also important to assess via ultrasound the movements of the elbow, but it is important to repeat that a definitive diagnosis cannot be made by ultrasound alone. And for this reason, it is strongly recommended that the pregnant woman undergo amniocentesis, followed by a comprehensive genetic consultation.